Good morning. Thank you, Madam Chair and members. In the years since the Dobbs decision, California has led the nation in protecting reproductive freedom. But even though with those protections, gaps in access to care still remain. The reality is simple. We already have a workforce that is trained, is qualified, and ready to provide this care, but they are restricted in the ability to do so. Nurse practitioners, certified nurse midwives, and physician's assistants, also known as advanced practice clinicians or APCs, receive extensive education and training. They are already safely providing a range of reproductive health care services in California today. However, current law puts outdated limits on what these providers can do, regardless of their training or their patients' needs. These restrictions mean patients are turned away or forced to wait longer for care. And for patients, delays have real consequences. Longer travel, more time off work, higher costs, and even missing the window to receive care altogether. AB 1973 is about fixing these issues. It updates state law to allow APCs to practice to full extent of their training and proven competency. This bill is a common sense update one that allows the state to fully use a skilled workforce that patients trust. At a time when access to health care is under pressure nationwide, we should be removing barriers, not maintaining outdated ones. AB 1973 ensures patients get timely care from providers who are already trained, competent, and serving their communities. With me today, I have Dr. Mastey, an OBGYN with Planned Parenthood of Miramonte, and Bethany Golden on behalf of Asmara Gabe, a certified nurse midwife, and Angela Pontus, who's available for technical questions.
2 minutes each.
Thank you, Chair and members of the committee. My name is Dr. Nimi Mastey, and I'm a board-certified OBGYN and complex family planning specialist. I serve as the Associate Medical Director of Complex Family Planning at Planned Parenthood Miramonte. In my role, I train and work collaboratively with advanced practice clinicians, including nurse practitioners, PAs, and certified nurse midwives, to provide high-quality, evidence-based abortion care. I'm here in strong support of AB 1973. As you know, abortion care is safe and common. At Planned Parenthood Miramonte, our APCs have been trained in providing this care in California for many years. Our affiliates' clinicians participated in a landmark research study that showed that trained APCs provide high-quality abortion care to patients with equivalent safety, competency, and patient satisfaction outcomes as their physician counterparts. Having personally trained many APCs, I can attest that they are essential to our state's reproductive health care system and provide excellent patient care. As California faces widespread OBGYN and primary care physician shortages, care provided by APCs is more critical than ever. Even with California's legal protections for abortion, many people in our state live in areas that still lack access to abortion care. The need is most acute in the lowest income and more rural areas within our state. Within California, our Planned Parenthood affiliate has nearly 30 health centers that stretch from the Bay Area through Bakersfield. Despite covering such a large part of our state, we still see patients traveling up to 3 or more hours for abortion and miscarriage care due to the widening maternity and abortion care deserts we are facing. This limited access to providers further exacerbates existing healthcare disparities. People who already face barriers in accessing care are disproportionately harmed when abortion is out of their reach. The current restrictions to the provision of procedural abortions by APCs creates artificial limits based on gestational duration and techniques that are not based in science. These restrictions impede patient access to evidence-based care provided by trained APCs. By removing these restrictions, AB 1973 would expand the capacity of existing abortion providers in the state and address disparities in abortion access. I respectfully urge your support.
Thank you. 2 minutes.
Hi, my name is Bethany Golden. I'm a certified nurse midwife and the co-director of the Reproductive Health Service Corps. I'm going to be reading the testimony of my colleague, Asmara Gabre, who can't be with us today. Good morning, Chair and members. My name is Asmara Gabre. I'm a certified nurse midwife with 8 years of practice at San Francisco General Hospital, an associate clinical professor at UCSF, and founder of the Black Centering Group Prenatal Care and the Black Midwifery Fellowship in California, a $3.5 million state-funded program named in tribute to the Black women who provided full-scope reproductive care, including abortion care, long before it was criminalized. I am here in strong support of AB 1973. Physicians have trained me and supported of physician colleagues have collaborated with me throughout my career. That consultation is how midwifery works, and it is how AB 1973 works. I manage obstetric emergencies in my daily practice. Transfer and consultation protocols are not abstract to me. The bill preserves them for care beyond the first trimester. Through Black Midwifery Fellowship, I provide abortion care up to 13 weeks and 6 days. I have a clinical foundation to be trained beyond that, but current law prohibits it, so I step back and my physician colleague takes over. The training pathway exists, and the physicians willing to train me exist, but the statute is what stops me. Patients come to midwives for continuity, for cultural concordance, for a relationship that spans pregnancies. If a patient I've cared for needs a procedural abortion beyond, currently law forces me to hand her off to a stranger. Many of our patients do not need different providers, they need continuity, and the law says otherwise. California was the first to codify advanced practice abortion care in 2013. Because we were the first, the limits were narrow. Colorado, Vermont, Massachusetts, New Mexico have since safely allowed trained APCs to provide procedural abortion beyond the first trimester. California can do the same. The evidence shows that APCs provide abortion with safety and patient satisfaction equivalent to physicians, and this bill maintains rigorous in-person training, no online shortcuts, and the same physician consultation I've relied on. ABD aligns with the law with our current training.
Thank you. Do we have any lead opposition witnesses? 2 minutes.
Doctor and Senators, thank you. My name is Mindy Herzl with Sierra Pregnancy and Health. I'm a registered nurse certified in inpatient obstetrics, and I'm here in opposition of AB 1973. This bill would allow nurse practitioners, certified nurse midwives, and physician assistants to perform second and third trimester abortions, the most complex surgical procedures any of them would be permitted to perform by a wide margin. As a nurse, I have a moral and ethical obligation to advocate for my patients, not just those in my care, but any person whose health may be affected by the policies and laws that we make. In this case, that means women and their preborn children. We know the babies won't survive these procedures, but the risks are serious enough that the woman may not either. Lawmakers also have an obligation to advocate on behalf of the people. Proponents say this bill addresses disparities in women's health care. Those disparities are often due to substandard care. While that can be attributed to many different reasons, the solution is not less qualified care. Placing women in the hands of providers without adequate training and experience for these high-risk procedures does not close the gap, it widens it. This bill does exactly what you say you're against. It creates a two-tiered system where the least experienced providers perform the highest risk procedures on those least able to advocate for themselves. This is not equity, it's not advocacy, and it directly contradicts the values this body claims to uphold. I urge a no vote, respectfully. Thank you.
Thank you. Do we have any other lead opposition? You have 2 minutes.
Good morning. My name is Dr. Vanson Wong. I am an OBGYN physician with 31 years of experience as a clinician and administrator, having been in charge of abortion services and an OBGYN department for the largest healthcare company here in Sacramento. I vehemently oppose AB 1973. It will endanger the lives and health of pregnant women throughout the state. APCs presently perform first trimester procedural abortions, and it is the first trimester abortions where a study did document equivalence in terms of safety for both APCs and physicians. However, a second trimester procedure is an entirely different one with higher risks of life-threatening complications such as hemorrhage, intestinal perforation, and sepsis. Therefore, any claims regarding that AB 1973 is safe is pure speculation. The qualifications and training of APCs in this bill are vague and lax. A physician's assistant, for example, with absolutely no experience in women's health would be eligible to provide abortions after a training program. A current provider of second trimester abortions can be the sole judge of the competency of a new abortion provider. This bill begs for a standardized pathway to ensure that all new practitioners are sufficiently trained and are competent abortionists. There is no quality review in this bill. If we don't collect statistics on complication rates, how will we know if AB 1973 has created a system of safety or one of danger? To summarize, AB 1973 is fundamentally flawed. There is no requirement for specialization in women's health. There is no standardized training required for APCs, and there is no monitoring of the outcomes for APCs. It is a recipe for disaster, injury, and death. Please do not pass this bill.
Appreciate it. Do we have any Me Too's in support or opposition? Please state your name, your organization, and whether you support or oppose.
Jen Chase on behalf of the University of California in support.
Angela Pontus on behalf of Planned Parenthood Affiliates of California in support.
Martin Radosevich on behalf of Reproductive Freedom for All California in support. Thank you.
Greg Burt with the California Family Council in strong opposition.
Angela Hill with the California Medical Association with concerns, and thank the author and staff for working with us.
Samaya Nahara on behalf of the California Academy of Physician Associates in support.
Kathy Mossberg on behalf of Essential Access Health in support.
Sosin Madanat here on behalf of the California Nurse-midwives Association, proud co-sponsor in support, and also here to provide a courtesy Me Too in support for the ACLU California action. Thank you.
John Vogelsang, a retired board-certified OBGYN in strong opposition secondary to patient safety.
Brendan Rapicki on behalf of Teach, Training, and Early Abortion for Comprehensive Healthcare. We're a co-sponsor in support. Thank you.
Thank you. Seeing no other speakers, we're going to move to members of the committee. Seeing Senator Caballero.
Assemblymember, thank you for bringing this bill forward. Could you address the concerns that have been raised in regards to the standardized training and monitoring outcomes and those kinds of things? I mean, I think we all are concerned about
Safety.
safety. Yeah, and so if you could address that, that would be appreciated.
So the reality is APCs receive extensive training and are equipped with provide these procedures. And in fact, research shows that both APCs and physicians have comparable low complication rates. The medical community generally agrees that abortion safety is primarily tied to a timely access rather than the provider type. Nothing in this bill would allow an APC to do anything beyond their scope, training, or clinical competence. This is already existing law. The bill removes artificial legal barriers that prevent APCs from serving individual patient needs. And APCs would still be providing care that they would be trained to do as it goes forward. So there's nothing that's going to change from this law, just cleaning up something that's from an old bill as well.
Any other member?
I'll move the bill when the time's right.
Thank you. I appreciate that. I do want to ask Assemblymember that there have been a lot of people that have reached out on this particular bill raising concerns about safety in particular. I just want to make sure that we do have guardrails, that we are working with opposition to kind of address their concerns as it pertains to client safety. So I just want to highlight that. But with that, would you like to close?
Yeah, yes, I would. Absolutely. We're going to continue to work on this bill. There has been a couple of things that have come up, and we want to make sure that we get those addressed before moving forward. I think we need to be, obviously safety is the foremost thing that we have to do. We absolutely share the goal of achieving and ensuring patient safety, strong coordination of care. We are continuing the conversations with stakeholders to clarify the process for complex cases or emergency situations. And at its core, the bill is about aligning our laws with reality. With that, I respectfully ask for your aye vote.
Thank you. I have a motion from Senator Smallwood Cuevas. Could we get a roll call, please?
Motion is due pass to Senate Appropriations Committee. Wahab?
Aye.
Wahab, aye. Choi?
No.
Choi, no. Archuleta?
Aye.
Archuleta, aye. Arreguín?
Aye.
Arreguín, aye. Carrillo? Carrillo, aye. Grayson? Grayson, aye. Menjivar? Menjivar, aye. Niello?
No.
Niello, no. Smallwood Cuevas? Smallwood Cuevas, aye. Strickland?
No.
Strickland, no. Umberg.
That bill is out. We appreciate you.